Okay, here we are back with Debbie, and as you recall, as you've probably just seen, we equilibrated Debbie at our last visit, and that was at this point in time just about 5 weeks ago now. And we'd like you to do, Debbie, if you could, just share with us kind of what have been your experiences in the last 5 weeks. If you remember, we talked about, we equilibrated you in order to get rid of some of the dysfunction in those posterior teeth. You had the back teeth were in the way of your envelope of function.
Correct.
And we eliminated those interferences. And before we started, we indicated that there might be some restorative needs also on that left side. As we found out, everything came in pretty nicely without doing any restorations to this point in time. But tell us again, we haven't touched you in the last 5 weeks at all. Tell me what have been your experiences? What have you found?
Yeah, there's a major difference in my bite. It feels wonderful. It's very even. There's no sense of bouncing around trying to find a comfortable spot to close at. Everything's very even. Same time every time I bite.
Okay.
Feels
How the
wonderful.
jaw? You know, you didn't really have jaw pain or anything.
Not major,
but
no.
you would describe as your jaws waking up and feeling sore, tired. How have they felt?
They much better.
Okay.
Much better. I don't have any awareness of waking up with the achiness that I had.
Okay.
So I think my bruxing and grinding is better.
Okay.
Is better.
Now, when we did the workup on Debbie, we described to you, because of your history of grinding your teeth as a child, and some of the horizontal or symmetrical patterns were suggested that you may have a central nervous system component to your bruxing. And so I was less than completely optimistic that we'd be able to eliminate the bruxing or the parafunctional activities with just the occlusal therapy. But again, tell me, you said, I remember you saying earlier that your husband would complain that you would wake up at night, or he'd wake you up, you'd wake him up at night.
I can actually wake him up. I was grinding, so.
Okay. Now, how has that been since
He
then?
says it's been better.
Okay.
He hasn't noticed. He hasn't been waking up to it.
Okay.
So it must be better. And I've been feeling better in the morning. I haven't had the tiredness and the achiness in the mornings.
Good.
So I think it is better.
Good. Now, whether or not we've completely eliminated it, we'll talk about here in a few moments. I'm not ready to proclaim victory, so to speak, in the war against parafunction, but I think we have made some progress. And tell me, Debbie, since we did that, how you bite? Anything feel uneven at all? Do you have any sense of any awareness of any teeth at all in your mouth?
I feel very even. I just noticed I may be hitting towards the canines a little harder.
A little heavier towards
a little heavier towards the front.
One side or both sides?
Pretty even on both sides.
Okay. Is it like, so there's like one spot on both sides you're feeling seems a little heavy? Okay.
Correct.
Okay. Well, what we'll do, and again, we haven't done any adjustments on you since the time we did our first initial equilibration. Let's, first of all, I'm going to set you back.
Okay.
Let's take a look and let's see exactly where you're marking. You kind of remember from the last, when we took the film at the equilibration time, where your contacts were. Let's see where you're at now, and let's go in and do a little fine-tune adjustment, okay?
Very good.
And let's see what it's at.
Very good.
Okay, what I'd like to do, Debbie, let's show them, let's take a look at where you're actually marking now, okay? We had, what we'd like to have ideally are marked stops, occlusal stops, on the cusp tips and in the fosses. We talked about one of our objectives is to have nice axially directed forces or contacts on those teeth, all right?
Okay.
So let's take a look and see where you're at here.
Okay.
Let's clean them off here first real quick. Debbie, go ahead and bite down, just kind of grind and chew on that a little bit. Open there. And then go ahead and chop, 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 chop real hard. Open. Let's see where you're marking here. Okay, looks pretty good. If we can maybe zoom in on that, we can see very nicely here we have a nice pattern here where we have a mirror just to kind of point with. We see we have cusp tip, cusp tip, cusp tip, cusp tip, fossa, cusp tip, fossa, and very nicely we picked up the canine. And on the lower, have the mirror there, please. On the mirror, you're doing great, Debbie. How well you can see that too. We have nice, again, contacts on cusp tip, not really a fossa here because we have a little bit of wear and tear on these teeth, but you can see the pattern. That contact back there, I don't know if you can see it for sure or not, Terry. I want to adjust that a little bit, adjust these a little bit, but not too bad. Let's go over to the right side. Bite down and grind. Open. And chop, 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 chop. Open. And again here, I think you can see very similarly here we have a couple contacts I want to refine a little bit here. Cusp tip fossa, kind of on an incline there I don't like, kind of an incline there I don't like. On the lower, you can see it seems like we have a little wider area of contact on the right side than on the left side. some of the contacts a little broader than I like, and we'll go in and, excuse me, go in and refine those a little bit. But basically still we see our, again, our primary plunger cusp being the lower buccal cusp. We see nice contact on all the buccal cusp tips of the lower molars. And again, very nicely too, I think you can see, I don't know how well it marked, but we do have a nice contact on the canines. And you'll see again, to remind everybody, bite down now. We have no contact holding on the anterior teeth. Just a very light dragging, but not holding. Now let's take a look at the excursive contact. Let's take a look at excursive contact. Now, if you could just dry that off. I don't want to smudge everything here. Then you could go ahead and bite down. Now slide to the right, as far as you can go. Squeeze back, left, squeeze back, forward, squeeze back, and grind. Now is this film? You want film? Open. Okay. All right, here. Okay. Let's clean these off. Yeah, we want film on this. Bite down, grind a little bit. If we go with the silk, which is what that was, you're going to get a little bit of extraneous marks because it's so thick. Let's start with the, go ahead with the original. Yeah, go ahead and bite down, slide to the right, squeeze back, slow down, squeeze back, forward, squeeze back, slow down. Just kind of grind around. That's kind of grind and chew. Open. And chop, 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 chop. Open. Okay. Again, we see here, we don't want to see any red where we don't have black. And the only areas we see a little bit of it looks like a working contact here and here. One thing, we could go in and adjust that, but to be honest with you, one of the things we're going to be doing is, as we discussed earlier, is we're going to be aesthetically building up the 6 upper anterior teeth. In fact, we will be doing that today and doing a follow-up on that in about another month. So again, I can go in and eliminate this interference or this contact, but very likely when we build this canine up, we're going to develop the rise that we need. So we're not going to go in and adjust that today. So, and we'll take a look at both of these after we're done refining the anterior guidance on these teeth when we add those restorations. Okay, if we could have the red again, red film, please. And let me have that's easier to see, I think. Okay, bite down, slowly slide to the right, squeeze back, left, squeeze back, forward, squeeze back and grind. Open here. And then go ahead and once again, chop, 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 chop. Open. Again there. I like what I see. I don't know how well you can see that, but again, there are no extraneous red marks at all. Again, a little bit again on the first bicuspid here because Debbie has had those canines flattened off quite a bit. And I think what we'll find when we are done, that we will, when we add on to this incisal of the canine here, we're going to eliminate that. But we'll review that after we're done. But it looks pretty good. And again, that's with no adjustment. Debbie, let's take a little break here, and then we'll come in and fine tune where those areas that felt a little heavy to you. Okay.
Okay.
All right, Debbie. Again, everything seems like it's looking pretty good, feeling pretty good. All I want to do is let's find those couple of spots I feel like they're maybe very slightly heavy or have a little more awareness of. And let's go ahead. We're already marked here from a little earlier. So go ahead. Just tap your teeth again. Open a little bit now, Debbie. I'm going to go like 1, 2, 3. I'm going to touch different contacts here. Tell me if one of these feels like it's the one you're feeling, okay? This seems to be a good way to do it. 1, 2, 3, 4. Any one of those?
2 or 3.
2 or 3? Okay.
I'm thinking 3.
Okay. Now, one more time, let's mark here again. Let's mark fresh. Just black. Chop, chop, chop. Open. Good. 1, 2. 1, 2.
2.
Okay, open here. Now I'm using a white stone here, and I'm barely touching these. Chop, chop, chop. Okay. And I'm going, while I'm in here, I'm going to go in and kind of refine some of the other contacts. Even though they're not heavy, I'm going to reshape them so as to most optimally axialize the forces on these teeth. We saw it especially on Debbie's right side here, so I'm not really taking away the contact and just kind of reshaping them a little bit and repositioning them very slightly. Okay, Debbie, go ahead and mark again. Chop, chop, chop. Open. Good. That's a little better there? Yeah, that's all it takes. It doesn't take much.
Yeah.
Okay, open here. Let's go on the left side now. Go 1, 2, 3, 4. Keep going. 1, 2, 3, 4.
3.
3, okay. So the first line on both sides. And these look like we do have a pretty heavy contact there. And again, here I'm going to go in and just kind of refine. Although there's not a whole lot of refining. These contacts look very, very, very nice on this left side. There's not a whole lot else I want to do there. Again, I'm not really eliminating contacts, just really kind of reshaping them. And again, I think you can probably see that that working contact or interference on number 12 here. But again, that I think we're going to find being eliminated once we add on to the canine with our veneers. So, got to give that a try. I didn't do much there.
Good.
You sure? Now, give me a squeeze. Squeeze as hard as you can. Any awareness of any more pressure on any one tooth than anyplace else?
Feels good.
That good? Okay.
Feels
Very good. All right, well, tell you what, let's leave it at that, and we'll set you up here, and we'll talk about what we've done and what we're going to do next.
Okay. Okay.
All right, I think at this point, I think we can pretty much declare the equilibration done, and it feels real good.
Feels
Great.
wonderful.
The next thing we want to do, the next thing we'd like to do, we talked in the beginning, one of your goals or one of your objectives was to improve the appearance of your front teeth, okay? Those front teeth are pretty badly worn down. In fact, Terry, before we leave, I'd like to get kind of a close-up on Debbie's front teeth, okay? Just to give them a sense of what they actually do look like up close. But again, at this point in time, we're looking at doing veneers on at least the 4 anterior teeth, the 4 upper front teeth, and probably touch up the points, so to speak, on the 2 eye teeth.
Okay.
Now, the big question here, and an important thing for us to understand is, are you still going to grind or brux your teeth or clench your teeth? Okay, very, very important thing for us to know. And I still don't know. I mean, I feel pretty good from what you've described. I feel pretty good, but we have 3 choices. There's 3 ways we can go about this. One way is we could go in and make a bite plan for you. I can make a bite plan for you to wear, and wear it for a period of maybe 6 to 8, 10 months, and just look on that bite plane if you are making any marks or tracks. If you're grinding on that appliance, we'll be able to see where you're putting little facets into that appliance. That would be one way we could go. Another thing we could do is just be to assume that you are still bruxing or grinding your teeth, make a night guard for you, and we could go right ahead and make the porcelain veneers right now. And that would be, I think, an acceptable option. Another option would be, and what I would really recommend is that, because we still don't know for sure what the situation is with the bruxing, I'd like to just go in there, and before we go in and doing the porcelain veneers, go in and put some composite veneers on. Okay, composite veneers, we can basically think of them as being long-term temporaries.
Okay.
And as you know, whenever we go in and put porcelain veneers on or doing any anterior teeth, we want to establish a framework, something that looks and feels and functions exactly the way you want it to be. So we're always going to do some form of a provisional design or makeup on your teeth before we do the finals, okay? Now in this case, our provisional, our long-term provisional or our trainer is going to be the composite veneers. And what that'll allow us to do is to see, number one, are you doing that? Are you breaking them, chipping them? All right, and I'm looking realistically, probably getting at least a couple of years out of these, all right? And in addition, it'll serve as a very nice template or an index to make the permanent veneers. So what we'll do is we'll go in and we'll do composite veneers, hybrid composite veneers on essentially the 6 upper anterior teeth, and we'll see how you're doing after a period of time. If we see that, you know, over a period of a couple of years that they're holding up very well, you know, I still would probably recommend, to be on the safe side, I would still probably recommend to you to wear a night guard at night, okay? It can't hurt. But the point is, we'll get a good sense of how really critical it is for you, all right? If we just go in there and say wear a night guard, honestly right now, I don't know how critical it is. And this will give us a good sense of knowing how how faithful you're going to have to be to your night guard.
Okay.
And I suspect that it's not going to be really that important for you. And I think, you know, if we find that those veneers hold up and perform very well over the next couple of years, I think we're pretty safe in going in and doing those porcelain veneers. And, you know, probably not wear a night guard at all, but maybe if you're having a stressful night or if there's something going on in your life that you might want to wear it, you know, to be extra safe, it's probably a good way to go.
Okay, wonderful.
So you okay with that?
Very good, yes.
All right, very good. One more note before we close here, this session. I'd like to say that having done, you know, hundreds and hundreds of equilibrations, I will tell you that my experience when I have manipulated and done techniques other than what we've used, you know, utilizing the deprogrammer, I was typically taking 3 to 4 visits to get the equilibrations finalized. And the little variations we see between the first appointment and this, why did things move or change a little bit? And I think you had a sense of how very, very subtle that was with Debbie. And this is pretty typical. This is pretty typical of what we see in patients, again, who have stable jaw joints. Is really due to differential mobilities of the teeth. And Debbie may have had some mobility in that tooth, and as those teeth tighten up, those contacts are going to become a little heavier because they're not intruding. They don't have the vertical mobility they had. And that was also a very important phenomenon we saw with the manipulation. But with the technique we use with the deprogrammer, where I'm not actually going by where the marks are necessarily, but by feeling the pressure with that 8-micron shim, because she's biting very lightly, it seems to really even resolve and pick up those contacts that are heavy, that are due to, again, the mobility. So again, I in my own personal experience, having gone to this technique has been something that has dramatically reduced the amount of chair time necessary to do the equilibration, and it's worked out very well. So with that, Debbie, we'll get those veneers done for you now, and we'll get back together with Terry in maybe another 6 weeks and see how you're doing. Okay.
Okay. Very good. Right. Thank you.
Okay. Before we close here, again, I would like to give you just a sense of how much actual wear there is on Debbie's front teeth. Not severe wear, but I would describe it, you know, a very significant amount of wear. And as you can see, from the loss of the vertical dimension, she's probably lost in the sense probably 2 millimeters off the incisal edges of the central incisors, and probably a good millimeter off the laterals. And again, there's been a significant flattening of the points on the cusp tips of the canines. And on the lower, not nearly as bad. We have a little wear. I don't even see where it's gone completely through the enamel on the lower. So fortunately, the majority of Debbie's wear and tear has occurred on her upper anterior teeth. So it's kind of isolated. And that's where we're going to be doing those veneers. And if we look right directly in Debbie's mouth, just to again see that, and we'll do a follow-up on this just to give you a sense of what we actually did add. Okay, open them. Again here, and you can see that there's quite a bit of wear on those 2 central incisors, a moderate amount on the lateral incisors, and really the canines are pretty good except for the very cusp tips. And what we're going to be doing is adding again approximately a millimeter and a half of length to the central incisors, maybe a half a millimeter to the lateral incisors to make them aesthetically looking really nice, and then add just very, very little to the cusp tips of the canines to really eliminate the working interferences on those bicuspids. And that's what we're going to do. And I said, we'll see you back in about 6 weeks, and we'll see how they're looking and feeling.